Welcome to the Exploring Strategies to Improve Health and Equity in Rural Communities conference call. My name is Hilda and I will be your operator for today. At this time, all participants are in a listen-only mode. I will now like to turn the call over to Mr. Michael Mead. Sir, you may begin.
All right, so thank you so much. And I want to thank everyone for joining us today. This has been a really important project for us over the past year. And all of you participated in this project in a number of ways, providing your expertise to us. And we really want to begin by thanking all of you and really taking the time to recognize the efforts that you put into this project. I do want to note that there will be time at the end of this discussion for question and answer. Do note that all of the lines will be muted so that we can keep some order on the conference call today. So when you have questions, please direct those to the host by using the drop-down function in the chat box in the webinar. So what I would like to do is just start off, again, with those thank yous. We had over 400 people contribute to this project in a variety of ways. But among those are some key partners. Our national partners on this project were the National Rural Health Association, the National Organization of State Offices of Rural Health, the National Association of Development Organizations, and the National Association of Counties. And then we also hosted a number of regional meetings and really relied on regional partners to help convene those meetings on our behalf. Those partners were the Southwest Center for Health Innovation, the Louisiana Public Health Institute, the Maine Rural Health Research Center, the Wisconsin Office of Rural Health, and the East Tennessee State University College of Public Health. In addition, because history and culture is so important in rural communities, we also engaged Dr. Melissa Schrift from East Tennessee State University's Department of Sociology and Anthropology, and she contributed a lot to this project really from beginning to end. And then finally, I want to extend our gratitude to the Robert Wood Johnson Foundation for supporting this work. The foundation was collaborative throughout this project and highly engaged in helping direct the project activities to make sure that we were providing information back to them that would have utility for the foundation, for other philanthropic funders, for national funders, and for stakeholders throughout the country. And we really could not have pursued this activity without them. And with that, I want to start things off by turning things over to Katrina Badger from the Robert Wood Johnson Foundation and let her describe a little bit about the motivation behind this project. Katrina is a project officer for the Robert Wood Johnson Foundation, focusing on efforts to improve social and economic conditions that foster healthy, equitable communities with a particular focus on low-income communities and communities of color. So Katrina, let me hand it over to you so that you can help us get things kicked off.
Thank you, Mike. And I really am pleased to welcome all of you today. And on behalf of the Robert Wood Johnson Foundation, thank you all for taking the time to join us and hear more about these findings from the NORC Walsh Center that have been really important to us. As we all know, rural counties rank lowest among counties across the country, with premature death rates worsening, particularly in western and southern parts of the country. Initiated by the 2016 County Health Rankings Report, we at the Robert Wood Johnson Foundation undertook an intentional learning process to develop a more comprehensive understanding about the strengths, gaps, and threats, in particular, to health and well-being in rural communities, and to identify new opportunities to accelerate or catalyze efforts to improve health and equity in rural America. This rural focus is not a new strategy for the Robert Wood Johnson Foundation, but really a new intentionality in understanding the broader context for our work as we strive to build a culture of health that provides a fair and just opportunity for everyone across the country to reach their best possible health and well-being, regardless of where they live. So our support for this work done by the Walsh Center represents one really important element informing our rural learning journey over the past year and a half. And through this project, our goal was to learn more deeply about the strengths and assets of rural places and opportunities to support and build on those assets to fundamentally improve health and equity and then to share those lessons with others, like all of you. So, given that 1 in 5 people across the country live in rural places, this is an incredibly important focus for our culture of health efforts, and we see it as a core element in our work to achieve health equity. Health equity means to us that everyone has a fair and just opportunity to be as healthy as possible, and we know this requires removing obstacles to health, such as poverty, discrimination, and their consequences of those, including powerlessness and a lack of access to jobs with a fair pay, things like quality education and housing, safe environments, and healthcare. And we recognize that these obstacles look different in different places for a variety of reasons, and that the assets and opportunities also look different in different places. So, if you'll give me a couple more minutes to give you some broader context as you listen to NORC's findings, these couple of maps here, they were developed by the Virginia Commonwealth University and take a look at the Raleigh-Durham region, which give us an example of how dramatically life expectancy can vary between more rural places and more urban areas within the same region, both across counties, as seen in the map on the left, and within counties, as in the map on the right. So we believe strongly that where you live and your zip code should not determine how healthy you are. We have many examples of these different kinds of disparities, but we're really encouraged and inspired by the multiple examples of practical and innovative on-the-ground solutions for reversing these disparities and achieving equity in rural places. I wanted to give you one example. Garrett County, Maryland, one of our Culture of Health prize winners from last year, that we've found inspiring in how they address poverty in their rural county with a long-term commitment across sectors, engaging community members, and applying an array of resources. A couple of examples. Garrett College is a 2-year college that offers full scholarships to all high school graduates and graduates of the county's GED program, and more than 800 students have benefited from these scholarships since 2006. Garrett County's 2-generation program coordinates wraparound services for families in need, including child and elder care, job training, and a lot of other services. Their Wheels to Work program helps low-income families get cars so that they have a way to get to and from their jobs. And the strong spirit of collaboration in Garrett County is evident in the way that public and private partnerships and have joined forces to expand low and mixed income housing options and foster economic development and job growth. That their county is also helping residents get online by expanding broadband services. And those are just a few examples of the things they're doing. So Garrett County is just one example. Many communities and many individuals across the country are engaged in similar initiatives, we know, and we hope that this report also will move even more communities to action. So, in addition to our Culture of Health Prize program, which is open for applications in the late summer, early fall of every year, and they're always hoping to have more and more representation from communities of all types and sizes, and certainly rural communities among them. We also have 4 large leadership programs we think of as pillar leadership programs aimed at recruiting people from all types of communities across the country. And they certainly want to make sure that they have representation from leaders in rural places and working in rural places across the country. One in particular I wanted to highlight is for this year, the Interdisciplinary Research Leaders Program, the 4th one over, has an explicit focus solely on rural leaders and leaders working on rural issues this year in particular. I'd encourage you to look at all 4 of them on our website, as they're all open for application right now. Our Culture of Health Leaders program closes the application cycle on February 21st. And the other 3 are open through the middle of March, and they're opened at the beginning of every calendar year. These were just a couple of examples of ways that we're intentionally considering rural communities and leaders within our strategies and programming across the foundation, and I'm sure you'll see more examples of that come out over the next year or two. And finally, I want to acknowledge that it will take all of us to create our culture of health and to create opportunities for everyone to live the best possible health and well-being. So that means all of us, all of you as well, and I'd ask that you really take a look at these recommendations from the Walsh Center's report and help us bring them to life. So we hope that this both stimulates conversation as well as action, and we'd really welcome all of your input. We hope that we'll learn from your successes as well. And with that, I'm happy to turn it right back over to you, Mike, to share your findings.
All right, thank you so much. So again, most of you on the call today participated in this project. And again, we want to thank you for all of your participation. What I want to do is I want to give you just a really brief background, a refresher on what we did. And then I want to spend most of our time walking through the findings. So the project itself had three main areas of focus. The first was really focused on strengths and assets in rural communities. So we were charged with focusing on formative research to identify strengths and assets and think about ways that will help to accelerate and improve health and equity. That was really important because often our focus is not on strengths but on deficits. So this really allowed us to take a fresh approach to thinking about ways to improve health and well-being. In addition, the second area I think is also really critical, and that was to look at cross-sector partners. This is really a hallmark, I think, of rural health activity, is that partners come together at the community level to address locally identified needs. So thinking through who are those key partners, who are the key sector organizations that need to be at the table to really engage in community health activities. And then ultimately our goal was what we're really here to discuss today, which was coming up with a set of recommendations for funders that includes both philanthropies and federal government agencies to think about ways that they can support rural communities without duplicating efforts that are already existing. And as I mentioned, this is, I think, probably the key difference of this work as opposed to much of the work that we've done previously. So those of us who do rural health research are often asked to look at the challenges that exist in our rural communities. We're often asked to identify barriers or disparities, and that's all really important because we need to understand the problems that we are hoping to address. But at the same time, it can be a little bit debilitating. If all we ever do is focus on the problems that we have in our communities, it's a little hard to turn the corner and think about how we address those problems and what we're actually trying to leverage to improve community well-being. And that was again, really, I think what was refreshing about this project. When I describe this project, I always tell people that this is probably the first time that we had resources to be able to go into communities and ask the questions, what is going right in your community? What are you proud of? What works? And that just creates a much different dialogue and something that we often don't have the opportunity to hear. And I think that that really informed what we did, but also gave us a different view of how we even look at rural health. In terms of the data, information, and sources, we did a very comprehensive literature search at the beginning of the project, and then we really started talking to a lot of people. We began with a national discussion forum. We did a series of key informant interviews. We then went out to communities around the country and convened regional forums. Following that, we did vetting sessions all over the country. We did 6 of those vetting sessions, including a large vetting session in the Appalachian region. We also engaged non-sector health partners. We worked with the National Association of Counties to convene people at their Rural Action Caucus, and we also did a focus group with the National Association of Development Organizations. We then presented feedback, or presented information and gathered feedback at 9 conferences. And the last two items here, I think, really are what this comes down to. At the end of the day, we were able to gather information from across 36 different sectors, and we were able to talk to participants for this study that included over 400 individuals from across those different sectors. So again, really broad information, and it's really something we're very proud of. And this is what we ultimately did with this. And hopefully you've all been receiving the emails that we've been sending out with the links to this information. But we have now done a final project report for the foundation, and we did 3 practice briefs. And those practice briefs are really what we're going to highlight today. And of course, they all come out of what's in the final project report, but they are focused on culture and history as assets, change agents across sectors, and recommendations for philanthropies and government agencies. Again, those 3 main focus areas that we were charged with addressing. All of this can be found on the Walsh Center website, walshcenter.norc.org. And again, we will continue to send out those links and encourage you to help us with the broad dissemination of the project findings. So if you can continue to send those out to all of your partners, we would certainly appreciate that as well. So this is what the first brief looks like, and it's entitled Leveraging Culture and History to Improve Health and Equity in Rural Communities. Again, it's available on our website. And just to walk you through some of the findings from that, we wanted to begin really though with each of these with a quote from our project. Again, we talked to people, hundreds of people, and got some really good information. And some of what we were told just really resonated with some of the different topics that we're addressing. So from one of our interview participants, we heard that culture and history are the connective tissue in rural communities that is more important than anything else and will ultimately drive the change to improve health status. Some of the things that we heard in talking to people about cultural and historical assets are that culture and history shape the core values of our rural communities. Importantly, however, we also heard that this is not monolithic. Just as we know our rural communities differ across the country, much of that is shaped by those differences in culture and history in those different regions. It shapes how assets can be leveraged and influences how programs, policies, and practices to improve health equity play out. And it's also important to recognize that there are historical patterns and events that have lasting impacts on the culture of peoples within these regions and influence how we address health and equity in those communities. Some of that relates to historical trauma, some of that is positive in nature, but at the end of the day, it's important to understand the culture and history of the places that we hope to engage in. So walking through the recommendations under this heading of cultural and historical assets, our first recommendation was to build relationships and trust. I think really the key message here is that we cannot do helicopter research. We cannot come in as a national entity and expect to implement a program that is going to work in any given community. We need to understand the culture and history of those communities, and to do that, we need to build relationships and foster trust. And some of that happens by helping the residents themselves feel ownership over the solutions to the challenges that their communities face. So what does that mean in terms of strategy? It means that we need to be thinking about who is on the ground in those communities that we can work with. We need to have trusted, credible agents who can serve as our liaisons. We need to utilize practices such as community-based participatory research and asset-based community development to identify the locally driven solutions. And we need to include populations who we are trying to target with our activities. So that also includes the historically marginalized populations and newly arrived populations. They need to be at the table if we hope that our interventions are going to work on their behalf. Our second recommendation in this area was to identify and grow rural leaders, including youth. One of the things that we heard in every community that we went to is that there has been a loss of youth in many of those communities, and that there's concern that they don't know where the next generation of rural leaders is going to come from. So along those lines, we heard loud and clear that youth are an asset, that they embody the characteristics of the culture within those communities, and that we need to think about strategies to engage youth in our community activities, to develop leadership skills among those youth, to mentor them so that they can be that next generation, to include them in leadership development programs. And along those lines, there was also a recommendation of developing a rural-specific leadership program. So again, I think leadership will come up again as we go through these recommendations and thinking about ways to engage people in our communities to serve as those leaders. Our third recommendation was around developing rural-specific communications and messaging. We need to understand our audience, and again, understand that that audience differs in different regions based on different cultures and histories. And we need to target our audiences so that they resonate with those different rural community members. In addition to targeting the messaging and making sure that they resonate, we also need to leverage local media and recognize the power of our local rural media in disseminating health promotion messages and connecting our community members to resources. And we also need to support initiatives to focus on balanced, solutions-oriented journalism to promote positive perceptions of rural America. This is in here really for a very specific reason, and it goes back to what I was saying at the beginning, where often we focus on deficits and challenges. Unfortunately, the media do that as well, and 9 times out of 10, the stories that we hear about rural America are describing the problems that our communities face. And while there may be challenges, we know that there are also really good and important things going on in our communities. But if we never highlight those, the perception that people are going to have of rural America is that those things simply don't exist, and we need to break that pattern. And I would argue that if the only stories that came out about urban communities or suburban communities were everything bad that happens in the communities, we'd have just as negative perceptions about those communities as well. So that's something I think we just need to break. Our fourth recommendation in this area is to engage with regional and local intermediaries. Again, this kind of goes back to that idea of breaking a cycle of helicopter research. We need to know that there are organizations in our communities who are embedded in those communities and have a much better understanding of local culture and history, past experiences, and regional assets. And we need to support those organizations in roles that can help to facilitate the implementation of promising rural strategies. They can provide any number of different roles within those communities related to capacity building and technical assistance, such as serving as backbone or network organizations, convening partners, serving as resource hubs, or serving as technical assistance providers. And we need to collaborate with those organizations as partners on our national initiatives. So we need to be thinking about implementing national initiatives in collaboration with those regional and local intermediaries to make sure that that local flavor is embedded within what we are doing. And then our fifth recommendation in this area, our last recommendation in this area, is to think about some areas where we need ongoing and continued rural learning. So for each of our different topic areas, we have this recommendation of continued rural learning, and that's a recognition that we don't know everything to date about what research and what activities will work in our rural communities. We need to conduct further research to identify and build the opportunities to know what will work for improving health and equity in our communities. Some of the different specific rural learning that we heard from all of you that we think is important for continued research are understanding the growing impact of diversity in our communities. Our communities are becoming more diverse, rural and urban, and we need to think about what that means for overcoming structural and institutional racism that may exist within those communities. We need to test rural communication strategies so that we know what messages will work in our rural communities and what will resonate. We need to explore relationships between rural assets and health outcomes. So we need to think about what are the specific rural assets that can be leveraged and how do those play out in terms of improving health. And again, we need to use those community-based participatory research approaches to enable communities to identify strengths and capacities and to build and grow those strengths and capacities within our rural communities. So moving on to the second practice brief. The second practice brief was focused on supporting change agents across sectors to improve health and equity in rural communities. And the quote that we have here, it's a little bit long, but we thought it was a really important one because it identifies some of those different sector partners. So one of our interview participants said that if you were thinking about change agents in rural communities, it's going to depend on what the trusted brand is. It may be community colleges, they've done a good job and they try to anchor themselves in the communities. Libraries work to be the anchor too and to be responsive to the needs of the community. Faith-based organizations are often key for health, wealth, and self, and they are always key when it comes to bringing change. And as you can imagine, as we went through, we heard about several other sectors as well. And this is just a sampling. The slide would have gotten much too small had I put all of the different sectors we heard about. But you see that among these change agents, I think first and foremost are the residents themselves. We need to engage the residents. But many of these other organizations, the faith-based organizations, cooperative extension, local government, transportation, all of these sectors are important to improving health and well-being in our communities. So in terms of the recommendations for cross-sector engagement, the first recommendation that we included is to foster cross-sector collaboration. One of the things we heard frequently is that in small communities where everyone is under-resourced, partners naturally come together and work together to mutually support one another. That is a rural asset and something that we can leverage in our rural communities and strengthen. Some of the strategies that were recommended to strengthen that were to encourage national associations to work with their regional and state affiliates to serve as cross-sector conveners, and to develop rural cross-sector network development programs to engage local partners working towards common goals. And as we make that recommendation, I also want to call out the work that we do with the Federal Office of Rural Health Policy, because I think that they do a really phenomenal job of network development. And we can be using that as a potential model to think about how do we include other sector representatives within those types of networks. The second recommendation that we had in this area was to foster cross-sector learning across communities. Another thing that we heard uniformly in all of our meetings was we want to know what's going on in other communities. It was often the first question we had when we would do regional meetings, were people in the room saying, "This is great, we're engaged, tell us what's going on in the other communities you visited." So thinking about a way to formalize that cross-sector learning and identify solutions that can be implemented across regions and across communities, I think is really an important recommendation. Strategies to do that include peer learning, and that can be included in existing programs and efforts. And we also had our partners recommend a rural peer learning community for cross-sector rural partner community engagement. So again, formalizing that through a learning community. The third recommendation was to develop rural cross-sector advisory panels. Many of our projects here at the Walsh Center, I'm sure this is true for many of you on the phone as well, we often include advisory panels because we know there are a lot of smart people out there who work at the community level, and we want to have their really good thoughts to inform what we are doing. Being intentional and thinking about who from other sectors should be part of those panels, I think, is really an important thing that we can be better at here at the Walsh Center, and all of us can be better at together. So thinking about ways to support the development and facilitation of these cross-sector panels, to plan and structure implementation efforts, and to develop recommendations, including cross-sector experts with extensive experience when doing our work, and then disseminating and vetting recommendations to regional and local affiliates of those different cross-sector partners to facilitate broad implementation. And then our fourth recommendation here, this one really, it kind of gets in the weeds with a specific sector, but it is such an important sector that underpins so much of the work we do. We thought that this was really something that was important, and we heard from you that this was something that was important. And that is to support economic development efforts. So much of what influences health and well-being in our communities and improves equity in our communities really comes down to having economic opportunity in our communities. So thinking about ways that we can invest in our rural communities that include the health sector, but also beyond the health sector. Thinking about ways to increase collaboration beyond the healthcare sector and other community development and economic development activities. And then broadly supporting our rural communities by engaging in wealth creation. Again, uplifting our communities so that everybody is doing better economically as well as in terms of their overall health and equity. And then again, as before, there are areas where we still need to learn. So thinking about additional areas where there's continued need for rural learning. Some of the things that were identified here were understanding the role of informal networks in communities and how those can be mobilized for change. Much of what we understand about rural networks are the formal networks, but we know there's a lot of informal networking that goes on in our communities as well. And then thinking about ways, facilitators for developing and maintaining cross-sector partnerships in our rural communities to sustain mutually beneficial cross-sector engagement. It's hard to partner, so thinking about ways that we can strengthen and facilitate that partnership in an ongoing way. And then finally, the last set of recommendations, the last brief that we did, it's recommendations for philanthropies and government agencies to improve health and equity in rural communities. Again, all of these are posted on our website. They are 4-page briefs. We encourage you to download these and disseminate them to your partners. So the quote that we have here again from one of our interview participants, the innovation to improve health is often not what is missing. The innovation is there on the ground at all levels. There's a huge gap around peer sharing of projects and models and approaches that work. There's an appetite for it, but not the time or the resources. This was basically told to us in the context of things that foundations and federal agencies can do to help spread these innovations to other communities. So one of the things that we have heard throughout this project is that innovation happens naturally in our rural communities, that in the absence of resources, people come together and do really phenomenal things, and trying to describe what is going on in those innovations, to identify the factors that facilitate those innovations, and then to spread that innovation, to replicate it and sustain it in a way that can be built out among other communities is really ways that funders can support rural health. So some of the recommendations, so philanthropies and government agencies are well positioned to leverage rural assets and change agents, thinking about ways to adapt existing programs, policies, and practices to benefit rural communities, and considering focused approaches to strengthening and empowering rural communities to partner and collaborate on solutions to locally identified priorities. Again, helping us to identify those solutions and to replicate those solutions in other communities. So getting into some of the specific recommendations, the first is to leverage existing efforts to impact rural communities. So this is kind of the low-hanging fruit in many ways. We know that funders all over the country are funding rural communities to do rural work in all of their existing programs, even if those programs are not specifically focused on rural health. So you may have rural grantees within a program that funds 30 communities, maybe 5 of your grantees are rural. Identifying and highlighting the work of those rural grantees is a way to uplift and take credit for the work that you're already doing and find ways to then package and disseminate that so they can be adopted elsewhere. So thinking about what is the rural focus and what we're already doing, elevating the components of our programs that are rural in nature, disseminating that so that it can be spread to other communities. And then where it's feasible, thinking about whether we should intentionally carve out opportunities for rural communities within those existing efforts, thinking about ways that our grant programs can reflect rural priorities and context so that rural communities will want to apply and be a part of it, and then partnering to ensure that any of the promising strategies and approaches are properly disseminated out to those rural communities. The second recommendation we have here, some of these start to dig into some of these themes a little deeper. The second one is to adapt rural funding, adapt funding strategies to better support rural communities. I alluded to some of these already, but some of the additional recommendations that we received were to think about whether it's possible to have longer funding cycles so that you can provide some additional support to identify and leverage assets, build local capacity, and generate buy-in. There may need to be a little bit of a longer glide path for our rural communities in implementing some of these programs. Providing support for operational and indirect expenses to allow rural communities to build grants management capacities. This is something that we've heard of frequently as a barrier to our rural communities, so allowing for some of that support where they may not be able to have it from other sources. Thinking about alternative ways for rural communities to achieve matching requirements, such as in-kind support or partner support. One of the things that we heard is that when monetary matching requirements are required, sometimes that's a non-starter for our rural communities that simply don't have the resources. And then just thinking strategically about how we balance consistency across grantees, which is something that is absolutely needed by funders, but how do we balance that with flexibility to determine and address local strategies and solutions? The third recommendation we have here, again, takes us even a little bit more granular, and that's to try to think about ways to provide opportunities for all rural communities. So what do we mean here? So one of the things that we did here is that even among our rural communities, there are haves and have-nots. There are some rural communities that have built grant writing capacities, that have built local infrastructure, and they are more successful in leveraging resources on behalf of their community than other communities that may be ready for change but don't have some of those capacities. So thinking about, again, strategic ways to address this. Are there ways that we can develop grant criteria that reward potential success factors? So thinking about readiness for change. Are there ways that we can partner with regional and state organizations to help identify communities that have that readiness for change but have historically lacked the external resources to apply for those grant opportunities? So again, thinking about strategic ways to provide opportunities for a broader array of rural communities, not just those that already have those capacities in-house. Again, along those lines, thinking about ways to strengthen community implementation capacity. So even as we think about ways to spread the wealth to other communities, are there ways that we can build implementation capacity so that more communities are primed, are ready to leverage the resources that may become available? Areas of capacity that we heard about throughout this project were engaging in community visioning and strategic planning, building networks and engaging community stakeholders, including peer-to-peer organizational mentorship, developing grant writing skills, designing and conducting evaluations, collecting and analyzing qualitative and quantitative data, identifying, documenting, and disseminating best practices, building a shared understanding of issues among community members, engaging in local and regional policy advocacy, and utilizing information technology. So a lot of areas where we identified across rural communities capacities that could be developed to put them in a better position to leverage resources that could become available. The fifth recommendation we have in this area is to consider rural communities as program sites. This is something that I feel very passionate about personally. I think that many of our rural communities have natural advantages to serve as pilot sites, to pilot efforts to improve health and equity. They are really primed to be able to test activities and interventions on a smaller scale using fewer resources. and there are fewer confounding factors. So there may be that there are fewer other funders who are trying to implement similar programs in their community so that you can isolate the effects of what you are doing as a funder in that community. That may provide you a better opportunity to evaluate the program, to develop whether there's an evidence base that can be developed around the program. And from there, you can think about replication and scalability to other communities. The other thing that we know exists really in buckets in our rural communities are these assets that we have talked about, including assets such as creativity and innovation. Our rural communities do a phenomenal job of really thinking how to maximize opportunity in the absence of resource. And as resources are constrained in many communities around the country, many of the solutions to our problems may be occurring in our rural communities already if we look at where to find them. Again, I think they are in a great position to be pilot sites for those kinds of activities. And then funders could offer specifically pilot grant programs, seed funding, mini grants, and demonstration projects to test some of these locally identified strategies and see whether they can be applied in other similar communities. And then finally, the last recommendation we have is to build the rural evidence base. Again, the Federal Office of Rural Health Policy has done a lot of phenomenal work in this area, and I'll share with you a little bit of that. But thinking about the evidence base of what works to improve health and equity in our rural communities so that with the limited resources that exist, we are all targeting those resources towards what we know works. So what this means is supporting local program evaluation so that we are collecting data, so that we are building the evidence, increasing research and evaluation capacity among our rural community partners, but also evaluating the programs as they're implemented, making sure there's technical assistance so that the data that are being collected are quality data, thinking about measures of success, whether those look different in our rural communities, whether there's context for those that is different that need to be incorporated, thinking about qualitative data collection and how that can supplement what we know from the quantitative data that we are gathering, and then finally using developmental evaluation strategies to study and document changes in relationships and capacities in our rural communities. And then this is what I was alluding to. This is the Rural Health Information Hub's Community Health Gateway. We are very pleased at the Walsh Center here to develop the toolkits on this gateway, but the whole idea behind this is to identify the evidence base that exists for the development of programs in these different topic areas, and we're always developing new toolkits. This is a one-stop shop, a resource for rural communities to think about strategies that they may be able to implement in their communities that align with an evidence base, and then to provide skills and capacities back to those communities on ways that they can collect data as they are implementing their programs, how they can evaluate their programs so that they can further contribute to that evidence base and help us keep growing the evidence that we know exists for what does work in our rural communities. And with that, I think we will go ahead and start to check in on the questions in the time that we have remaining. So it looks like one question we have is whether the PowerPoint presentation is available. If you reach out to me, my email is on this slide. I am absolutely happy to send the slide deck to anyone who is interested. And of course, the resources for this project are all available on our project website. That's on our website at walshcenter.norc.org. We will also be sending that out to all of the participants on this call and ask you to further disseminate that for us. And you'll find all of these recommendations included within those practice briefs as well as the final project report. So another question we have is, how do you see implementing these principles? So we are broadly sharing all of this information back to the Robert Wood Johnson Foundation as well as to funders throughout the country, federal funders as well as regional and national funders, part of our dissemination is to get this out to all of you. We encourage you to disseminate it, but we are also working with the foundation to disseminate this broadly through grant makers and health and other philanthropic funding organizations. And we are hoping that they will take these recommendations to heart and that can help to inform their efforts moving forward. So a lot of that implementation, I think, will happen as funders think about ways and strategies that they want this information to go out to rural communities themselves. I'm going through the questions here as they're coming through. So another question we have is, where will we go next with this research? These are topics that we continue to be interested in and want to explore further. We continue to talk to all of our partners at the Federal Office for Health Policy, Centers for Disease Control, Robert Wood Johnson Foundation, everyone, to share these findings broadly, but also to explore other areas where we know that there is further rural learning, and we're hoping that that there will be support to engage and address some of these questions in more depth. Let's see here. The next question we have is, can you elaborate more on recommendation 3, reward potential success factors? What are examples? I'm looking through this now. So the way that we described this was to develop grant criteria that would address some of these success factors and the things that we were thinking about. Some of these are tangible, some of these may be a little less tangible, but things like thinking about whether there is a local champion, whether the partnerships are in place. Again, thinking about some of those factors that we would describe as readiness for change. Are there other factors, tangible and otherwise, that we think may be in place in those communities where we think that is a community that would be primed for success, but may not otherwise be able to access some of the resources? So I think that's important, but we probably need to be thinking more deeply about that question as well. I think it's a great question, and I think that's another area where some of that continued rural learning might be helpful. We have a comment that rural news media are important to communications and messaging, but social media are too. I think that's a really good and important comment. We did talk about social media in our final report as well. We may not have pulled that out quite as well here in this presentation, but I think that that's a really good recommendation, and I thank you for suggesting that. Another comment we have is that regarding solutions journalism, there's an outfit called Solutions Journalism Network that could be a good partner, which I think is another good recommendation. And let's see. Oh, and we do have another comment as well that adaptability is key, which I think is a really good feedback and a good comment for us as well, that it's not just about change, it's about adaptability. Let's see if there are any other questions coming in. So we have a question. In our research, what did we find was the most significant recent changes to rural health? So I have thoughts on that. I don't know whether this comes specifically from this body of research. We do a lot of other work on behalf of other partners and funders as well, but I think some of the things that we are certainly seeing out there as we just think about the rural health environment that are impacting rural health. Clearly, there's been a major focus on rural hospital closures. That has been a major issue just in terms of accessing care, particularly emergency care in rural communities, that I think is important. The other one that we are hearing about on a daily basis is overdose, opioids, and we're giving a lot of thought about strategies to build community capacity and resilience to address opioids, which I think is important, but I would not limit to opioids because I think that same strength and resilience also allows us in our rural communities to address any of the other issues that we may face, and that includes chronic disease and other factors as well. that may be, I think our questions are slowing down a little bit. Let me turn things over and see if our colleagues at Robert Wood Johnson have anything they would like to add to any of those questions or any feedback they would like to provide. Katrina, do you have anything?
Sure. I think I can, just regarding the what do we see as far as bringing these principles to life, I can add a little bit from our perspective here. And I think, Mike, you really hit it on the nose when you said we're really hoping that many folks across this space, nationally and local leaders, are going to all see themselves in certain ones of these principles and recommendations, and that all of you might have ideas for how to bring it to life as well. I can say that these findings, these recommendations, as well as our other learning, have been and continue to be front and center across our strategy and programming conversations as we think about how our work evolves going forward. So in some ways, it already starts to come through in, for example, how the leadership programs have a specific rural priority this year. I also wonder, Mike, if you might talk a little bit about the typologies work that you all are doing, and we're planning to build on that typologies work with very specific rural analysis moving forward as just one other way that we're continuing to build this out. And I think we're still thinking about what more it could mean for us, for our partners, but certainly with intention around not just the strategy and program development, but the relationship development as we think about building deeper relationships and networks among rural stakeholders and rural communities across the country.
Mm-hmm. That's great. And regarding that typologies work, thank you for mentioning that, Katrina. So the foundation also supported a team here at NORC to develop a typology based on how people think about health. And so they implemented a survey. It was called the American Health Value Survey. And the idea was, it was basically, for those of you familiar with this field, it was basically a market segmentation study. So depending on how people answered the questions, we were able to segment them into different groups based on how they viewed the role of personal responsibility versus the role of government versus other factors, and whether different market segments would respond differently to different messages about health. So I think that was a really neat study, and I think we actually found some really important differences between how rural versus urban residents think about health on those different scales, on those different dynamics. And we now have funding moving forward to develop a separate typology based on that same survey to think about within rural populations, are there different rural typologies in terms of how people think about health? So we're taking that down one segment further now, or one level further, and I think that will have some major implications about that rural communications and messaging. So even as we talk about some of that continued rural learning, this is an example of how some of that's moving forward. All right. And I think that might be all of the questions that we have, and I think the timing is pretty good. What I want to do is just close by thanking everyone for participating today and for participating in this study more broadly. This has been a really, for us here at the Walsh Center, a groundbreaking study where we have the opportunity, as I mentioned, to talk to people about what is good about their communities, and I cannot think of a study that we've done that's been more uplifting. We have heard inspiring stories from all over the country, and we want to continue to share that message that there are positive things going on in our rural communities that we need to elevate and replicate all over the country, and I know that all of you are as passionate about that as we are. So we will continue to share information from this study and our other work to hopefully provide the tools and resources for all of you to be able to share that message. If you have any questions, please do not hesitate to reach out to me or anyone here at the Walsh Center team. And again, thank you all for participating today.
Thank you, ladies and gentlemen. This concludes today's conference. We thank you for participating. You may now disconnect.